Good afternoon and welcome. My name is Carrie and we're going to get started at 1:30. I just want to make sure that everyone's logged in, that their volume is up, and we'll be ready to go in just 1 minute. All right, hello everyone and good afternoon. My name is Carrie and I work for the Player Center for Child Health at Wolfson Children's Hospital. And today I have been asked to be a guest speaker with the YMCA Healthy Living Center's education segments. And so really excited to be here with you today. This is my very first Facebook Live and I've already messed it up. But second time's a charm. So again, really excited to be here with you today. And I'm going to be speaking on asthma. And most people are probably pretty familiar with what Wolfson Children's Hospital does. But I work for the Community Advocacy Center. And our center and team of people are dedicated to your child's health, their wellness, improving their quality of life for children here in Northeast Florida and South Georgia. So my role at the Players is I am an asthma educator with the Community Asthma Partnership. And so when a child comes to our emergency room, they're evaluated, especially if they come in as a known asthmatic, and we're able to see what's going on, what brought them to the emergency room that day, and sometimes the child is admitted for further evaluation and workup. But not all the time I'm in the hospital. Some days I'm able to be in the community with children in their school environment, also an after-school program, and oftentimes in a community event, and sometimes known as a health fair, educating families that have questions about their child's asthma, what it means to them, what worries them about their child's asthma. And we all know we've had a lot of extra worry these last few months and weeks dealing with COVID-19. So again, we're going to go ahead and get started. I know you'll be commenting as we go along, and I'm going to save to answer your comments at the very end of our 30-minute segment today, just because I don't want to miss anything. And so as we're going along, please feel free to comment on anything that I can do better, or if I need to speak louder, and we'll answer any of your pertinent questions to the end of today's segment. So when you think about asthma, the first thing that probably comes to your mind is your lungs. But actually, asthma affects more than the lungs. It affects the airways, otherwise known as the bronchial tubes inside of your lungs. There are lots and lots and lots of branches in your child's lungs. And hopefully you can see these. They look a little different. This is going to be an example of an asthmatic airway. You can see the mucus inside of the airway. You have the muscle bands that make the airway very tight, and as well the color is different. One is a darker pink versus a lighter pink, and that are three indications that your child's asthma has flared. And so a lot of times that will send your child to the emergency room. Again, the airways become tight, they produce mucus, and they become irritated and inflamed. And so when a child comes to the emergency room, oftentimes, again, we'll be able to figure out what brought them there, but also asking what worries you about your child's asthma. Scientists do not know what causes asthma, but it's typically from environmental factors and also genetics. And so when a child's asthma is diagnosed, that's something that we spend a lot of time going through the history part of what your child's environment looks like, and also the genetics for the child, and then being able to make a diagnosis. Because once the child has asthma, and this is oftentimes a question that I receive, can my child outgrow their asthma? And the answer to your question is no. Your child will never outgrow their asthma because it is a chronic illness. So again, scientists do not know what causes asthma, but when you have the accumulation of the tightness, the irritation, the inflammation, and the excess mucus, those three factors can make breathing very challenging for the air to move in and out of the airways. And if you have those things that happen time and time, again after again, then what happens ultimately is that you can have what we call airway remodeling, which is scarring of your child's lungs. And unfortunately, if the child's asthma is not controlled as a young child, it can affect their asthma and their lungs later in life. So again, control is something I'll continue to talk about through today's segment. So, what are some myths about asthma? Oftentimes a parent will say to me, well, Miss Carrie, my child, I didn't notice that they were wheezing last night. I didn't hear them coughing, so I didn't think it was their asthma. But there are many warning signs of a child's asthma besides a cough and besides a wheeze. So I don't know if you're going to be able to see this, but shortness of breath is obviously a very big indication. Oftentimes a child presents to the emergency room and you'll see their shoulders working very hard. Sometimes their nasal passages are flaring and their diaphragm, the belly that moves up, down the muscle, the diaphragmatic muscle moves up and down and out and in, and it's doing that at a very fast rate. So again, those are examples of the asthma warning signs that has brought your child to the emergency room. A lot of times too, a child will present with air hunger and you'll see their shoulders, their accessory muscles moving really fast and really hard. But what they're in training is excess carbon dioxide, and the carbon dioxide builds into the stomach, and therefore it pushes onto the diaphragm, and that's when a child can present that they feel like they're going to have a stomach ache or they feel like they're going to vomit. And it's not so much that it's a belly ache, but it's extra carbon dioxide, which is a warning sign of their asthma flaring. Oftentimes too, you can see the asthma start to flare on the skin, known as eczema. Eczema is just a fancy word for asthma of the skin. Not all children with asthma have allergies, but about 85%, that's right, 85% of children that have asthma can also have allergies. So the thing that we always reference to is asthma triggers. If you don't know what your child's triggers are, it's a great conversation to have via if your next visit is virtual with your pediatrician or if you see your physician face to face. But having that conversation to understand as a parent and caregiver what indeed are your child's triggers. I bet you can guess the number one trigger. You got it. Smoke. Smoke is the number one trigger for a child's asthma. And I know it's very hard to quit, but as an educator, that's going to be my first advice to you. We have to find a way to come together to make a realistic goal for you to effectively quit smoking. But I know things are not as easy as they always appear to be. So if you are going to smoke, that we ask that you do not smoke in front of your child, and that if you go outside, that we recommend a layer barrier clothing. That way when you come back inside, you can hang it up and the smoke is not directly onto the shirt fibers and the cotton that the child can inhale into their airways. Always right now too, especially with COVID, as we all know, we've been spending a lot of time at home. And for middle schoolers and our high school asthmatics, they've probably been spending a lot of time in their bedroom. And so you have to think about, again, the environment of what is in your child's bedroom. Dust mites is something that you don't see with your eye, but they live in your pillowcases, your blankets, if they have stuffed animals onto their bed. Those are things that you need to make sure that are being washed in hot water at least once a week for your bed linens. Oftentimes, too, now with us being home more, our four-legged furry friends become a sense of hope for us. And so children are spending a lot more time with their animals. And so you have to be very mindful of what your child is allergic to. And if they are allergic to cat hair or cat dander, dog hair, dog dander, that you're making the effort to make sure that the dog does not enter the child's bedroom. And most importantly, that the dog or cat does not sleep with the child at night, because all of that dander and hair just stays and accumulates into the child's bedding. Oftentimes too, we get excited with our animals and we tend to have the dog or maybe even the cat sometimes lick our face. And so saliva, believe it or not, can also be a potential trigger. So just make sure, being mindful, as we all have heard so much lately about the importance of proper hand washing for at least 20 seconds. That's also important after your child is touching or playing with their four-legged friends. Also, too, we're eating more at home, which can be a good thing in a lot of ways to be able to get healthier fruits and vegetables for your child. But with the increase at home, you're also snacking more. And so, with snacking and the abundance of food being cooked at home, that's going to also accumulate extra trash that may be laying around in the kitchen or outside into the garage. So, we have to be mindful of cockroaches. The last few days, I know we've had a little bit more rain, which was what much needed, but that's going to bring cockroaches into the home, especially with the moisture being very high right now, as we're entering the summer months. So it's not the actual cockroach that's coming to your home with the find the food and the crumbs in the bedroom, but it's the feces from the cockroach. I know it's kind of gross, but the cockroaches eat the crumbs, therefore they have to digest, and the feces turns into a white powder, and that's what your child's inhaling into the airways of the lungs. So again, just things to be mindful of. Of course, pollen, mold is a big thing. Back to the home environment. Spending so much time at home, showering more, therefore can accumulate an extra abundance of wet water and moisture in your child's bathroom. And so being mindful of good cleaning products and things that can make sure that the mold is properly being cleaned, and watching for buildup of mold in the child's tub or the shower. Again, so these are just some example of asthma triggers. If you're not sure what your triggers are, remember, just ask the pediatrician and they'll be more than happy to have a talk with you and also recommend some further testing so you will know exactly what your child's triggers are. All right, so we've talked about what is asthma. We've talked about the diagnosis of asthma. We've talked about triggers of asthma, warning signs of asthma. But before I forget, because you can tell I'm a talker, you can always visit our website at wolfsonchildrens.com/asthma, or you can also give me a call anytime at area code 904-202-5132. So if we're going along or you're forgetting to make a comment, you can always call me. I'm an old school kind of girl. I love to talk with you. All right, so now we're going to move along because I just want to be mindful of our time. Is your child's asthma medications? Most of you that have a child with asthma probably have several of these inhalers lying around in your home. Oftentimes, my asthmatic children will call this their asthma thingy, their thingamajig, or their puffer. And those are all great things, but it's actually called a meter dose inhaler. And I always try to educate the child to make sure that they know the proper term of what this is called and how to use it, because if they were to get into an emergency, most people probably would know what their thingamajig was. So this is the asthma inhaler. There's two different types of asthma medications. The first, which is most people are pretty familiar with, is your rescue inhaler. This medication is given on an as-needed basis. And I'll talk a little bit later about the warning signs of too much medication. But again, this is classified as the rescue inhaler. And then oftentimes, a child will have an additional inhaler that's called their daily controller. So with the child's inhaler, and again, I'm going to bring a little bit closer. This is ProAir. Remember, fast-acting rescue. On the back of the child's canister, most medications now come with a dose counter on the back. That's right. That's what it is. And again, so many times at the bedside, a parent or a grandparent will say, "Miss Carrie, no one ever told me before what that window is." And that will count down the doses of your child's medication. So you'll always know how many doses are left. If you've ever come to Wolfson Children's Hospital, you've probably or hopefully have received a spacer device. The spacer device fits on to the child's inhaler to allow for better delivery and better efficacy of the medication. The spacer is so important when you are using an inhaler for any medication. Whether you're 6 years old or 96 years old, we always want you to use a spacer along with your medication. So how do you use your child's rescue inhaler? Because oftentimes when I'm with a family, they'll tell me, oh, we do great with our inhaler. But when I go to look at their technique, there's always things that we can fine tune to make sure that your child's getting the medication that they need effectively. That's the key. So step one is you always want to make sure, and this is probably the most important step, is to shake your child's inhaler for at least 10 to 15 seconds. Not just once, but before every use. And the importance of why you need to use and shake the inhaler for 10 to 15 seconds. Because inside the canister, there's also what we call propellant. And the propellant helps to make the medication to be able to deliver tiny droplets so you can breathe the medication in deeply into the lungs. A lot of people don't know that. So when you go to open a brand new box, you have to prime the inhaler, which just means you're going to release medication. 1, 2, 3, and 4. You're going to release the medication for 4 times, and that's just when you're going to open a new box of medication. So you've released you've primed the medication. You also want to make sure that you're checking for the expiration date. This is really important. So many patients and families have inhalers, and they say, oh, I didn't even know it had an expiration date. So please be mindful and check your child's expiration date. And if you have an expired medication, definitely want to dispose of it properly. And I get it, a lot of times the months, the years run together. But if you are using an expired medication, it's only going to be 60% effective. And when your child is in a breathing distress, you don't want to take a 60% chance. You want to take a 100% chance. So check to make sure the medication is 100% effective with the spacer. So you're going to pop the canister into the boot, and the boot is the little red piece that I like to call the boot. And then we've shaken it up. Remember, 10 to 15 seconds is the key. And then you're going to insert it into the spacer. All right? Once you've done that, you want to make sure that you completely and comfortably empty the air out of the lungs. Remember, what goes out must come in. So we're going to slowly, and I'm going to release my air not into the spacer, but away from the spacer. So I'm going to take a nice slow breath, and I'm going to exhale out comfortably. I'm going to insert the spacer into my mouth, a good tight seal on with the lips. I'm just going to press once to release the medication. And then I'm going to breathe in down deep from my diaphragm, from my belly, for over 3 to 4 seconds. And then I'm going to hold my breath for up to 10 seconds. After I've held my breath for up to 10 seconds, the very last step is I want to exhale out through my nose. I'm going to wait 1 minute, and I'm going to repeat the steps as directed. I know, guys, this is a lot of information in just a 30-minute segment, so don't forget to visit our website, and I'll share that information with you at the very end. So again, we're going to do the same steps, and we're shaking it for how many seconds? 10 to 15 seconds to make sure that we're really shaking the medication up good. And that way the propellant is mixed, and we're all ready to go with our second puff of our medications. Now remember, the rescue is given as needed. If your child is prescribed a daily controller is categorized as an inhaled corticosteroid. It works totally different than an oral steroid. The inhaled controller goes one place. It only goes to your child's lungs. It doesn't go anywhere else. But if you're not using the daily controller daily, you're probably not getting much benefit. It's something that takes about 2 weeks to fully onboard into your system before you can start to feel the results. So again, daily controller is prescribed. In addition, a rescue medication also, but rescue is as needed, daily controller daily. Again, this is information you can always check with your pediatrician about or your lung specialist to make sure that you are clear on which medication is to be given as needed or medication that's to be given daily. If your child does take a daily inhaler, you want to be mindful that the child is rinsing their mouth, not swallowing, but rinsing, swishing, and make sure they spit out. That way they don't have thrush inside of their airways. A really important step. And also make sure that they're brushing their teeth if they take a daily controller. Asthma does have severities. Some children only have asthma about once a year. That's it. They're good to go. There are children that have frequent exacerbations. So again, understanding that your child's asthma can change season to season. It's very important that you have a clear understanding of what you need to do when your child's asthma were to flare. Also, another big piece of this conversation is to make sure that you have an updated asthma action plan. All right? The asthma action plan will give you the zones. It's a green, it's a red, it's a yellow. That way you feel comfortable to know what to do in a situation where you were starting to see that your child was having an asthma warning sign and that you were giving the right amount of medication, the right dose of the medication for them to get the full effect. The asthma action plan is your BFF along with your child's medication and spacer on hand at any time they were to get into trouble. The asthma action plan is something that should be updated every few months when you see your pediatrician, because your child's asthma symptoms can change. And the goal is that if they have great control, which we hope they do, then hopefully their regimen of using their medications will become less and less and less. Again, a lot of information in a very, very short amount of time. I don't see any questions coming up, so I just want to make sure I've talked about everything that I feel is of critical and utmost importance, especially during this time of us being home. I know we've heard so much about hand washing. I just want to stress that as well, especially when children are coming in from being outside right now, as we know that they need to be outside and trying to do some activity. But proper good hand washing for at least 20 seconds. Coming in from running errands if you've been out and about yet, and being mindful when they're coming in outside of the outdoor environment, because the pollen count is very high this time of year. So again, any questions that I can answer, if you're not comfortable posting something today, you can always visit our website at wolfstonchildrens.com/asthma, as well as you can give me a call at 904 area code 202-5132. But before I end today, I have an asthma song, because I don't know if I have maybe one or two of my asthma kiddos watching today's segment. But I miss all of you terribly, and this is a song that I came up with a few years ago, so I'd like to leave you on my asthma song. What is asthma? What is asthma? Now you know, now you know. If your lungs get wheezy, if your lungs get wheezy, just like this, just like this. Always take your medicine, always take your medicine. Ask for help, ask for help. You will feel better, you will feel better. Yes, you will, yes, you will. Stay safe, stay well. Don't forget to wash your hands. And remember, we at Wolfston Children's Hospital are always here for your children. Take care. Thank you.